Ever pondered over what a UTI is and how it can affect children? Well, there's no need to scratch your head any longer. Today we are going to delve into the nitty-gritty of urinary tract infections, or UTIs as they are commonly known. Hello parents and everyone, my name is Dr. Sihar. Please subscribe my channel to motivate me to discuss important illnesses of our everyday life. Now, first and foremost, what is a UTI? In simple terms, a urinary tract infection is an infection that affects any part of the urinary system. And this system is composed of the kidneys, bladder, ureters, and urethra. While UTIs can affect anyone, they are relatively common in children, making it a significant concern for parents worldwide. So what causes a UTI? The most common cause is bacteria entering the urinary tract and causing an infection. This can happen in a variety of ways that could increase the risk of UTIs in children, include poor toilet habits, constipation, and in some cases abnormalities in the urinary tract. Bacteria from the gut can enter the urinary tract through the tube that carries pee out of the body, urethra. This may happen when a child wipes their bottom, soils their nappy. Some children may be more likely to get UTIs due to problems emptying their bladder, and this can be due to constipation. Dysfunctional elimination syndrome, what is this? It means that a child holds on to their pee even though they have the urge to pee, vesicoureteral reflux. Urine leaks back up from the bladder into the ureters and kidney. Now, you might be wondering, how can you tell if your child has a UTI? Symptoms can vary, but common signs to look out for include a frequent urge to urinate, pain or a burning sensation during urination, abdominal pain, and in some cases fever. In infants and young children, these symptoms may be harder to spot, but they may appear irritable, have a fever, or experience a change in their usual eating habits. If you suspect that your child has a UTI, don't fret. Treatment is relatively straightforward. Typically, a course of antibiotics is prescribed to clear up the infection. In addition to antibiotics, ensuring that your child drinks plenty of fluids can help to flush out the bacteria from the urinary system. And in more severe cases, or if UTIs are recurring, further investigation may be required to identify any underlying issues. It isn't possible to prevent all childhood UTIs, but there are some things you can do to reduce the risk of your child getting one. Encourage girls to wipe their bottom from front to back. Make sure children are well hydrated and go to the toilet regularly. Avoid nylon and other synthetic underwear. Pick loose cotton underwear. Avoid scented soaps or bubble baths. These can increase the risk of developing a UTI. A small number of children have recurring UTIs. If your child has had a UTI before, it's important to watch out for any symptoms. If any symptoms do come back, tell your doctor as soon as possible. Summing it all up, a UTI is an infection that can affect any part of the urinary system. It's usually caused by bacteria entering the urinary tract, and symptoms can include a frequent urge to urinate, pain during urination, abdominal pain, and in some cases fever. If you suspect your child has a UTI, a visit to the doctor is warranted, and treatment typically involves a course of antibiotics and plenty of fluids. Remember, understanding UTIs and recognizing the symptoms early on can make all the difference. So keep an eye out for those telltale signs and ensure your child gets the necessary treatment if needed. In the world of parenting, knowledge is indeed power.